Welcome back to the news at 4. Idaho set another record, and it's not a good one. Statewide, nearly 39% of COVID tests came back positive over the past week, a lot higher than healthcare leaders want to see. And with that, many want to know what treatments are out there to help people feel better. Our Andrew Bartline spoke with public health leaders in our state. Andrew, what options do people have after getting sick with COVID?
Well, state health leaders continue to push preventative measures in the first place. They say vaccination is your best tool. Through December and January, health and welfare numbers show those boosted are 20 times less likely to die from COVID-19. But we know some people choose not to get the shot, and breakthrough cases do happen. So after infection, 3 permanent options are available in the state: a monoclonal antibody called sotrovimab and 2 antiviral drugs. These are tough: Paxlovid, molnupiravir. Kind of a mouthful. Paxlovid is the more effective antiviral drug, and you can see at the bottom of this graph those little horizontal bars. The state has a larger supply of molnupiravir, and specific numbers from the Department of Health and Human Services show 93 Paxlovid treatments are available in the state compared to 1,686 molnupiravir.
Ideally, we would have a lot more of both, especially Paxlovid. I don't know exactly why the manufacturing levels are the way they are, but I feel like Paxlovid is, again, clearly the preferred product in many situations. Molnupiravir is there in case we don't have enough Paxlovid, but you're right. Ideally, we'd have it flipped around and have a lot more Paxlovid.
Health and Welfare says the state received shipments every 2 weeks and works with providers to distribute Idaho's allotment across the state, of course, directing those doses and drugs to pharmacies where demand will ensure they get used. Health and Welfare says there is a possibility Idaho receives larger antiviral shipments, but Health and Welfare adds the numbers will stay relatively flat. They don't expect them to fluctuate very much. So the drugs are in short supply. They seem to remain that way now and in the near future. On the news at 6, we will hear about a new vaccine that's submitted for FDA review and why Health and Welfare believes that it could help aid vaccine-hesitant folks finally toward getting the shot. Morgan.
Andrew, and we should note too, Idaho isn't the only state obviously that's dealing with this shortage. It's every state around the country where these supplies of treatments are scarce.
Yeah, the numbers that we got from the Department of Health and Human Services, that website, it kind of has a bug on it that says they try to submit them to states based on population. So it's kind of all relative.
Okay. All right. Andrew Bartline, thank you.